Hello, everybody. Welcome back to another Q&A with Dr. J and myself, GC. Dr. J, in case you're new here, is the founder and CEO of MyHappyGenes, which is a direct-to-consumer genetic testing company that is so different than all the rest of them. And go watch a video, we talk about it. But basically, we don't just say one gene equals one disease or one potential risk factor. It's the whole body works together, and your biochemistry is very important in how gene reports are interpreted. So that's what Dr. J has built very simply for anybody to get started with, and or you can have a practitioner help you. Anyway, all of that to say, today we're going to talk about the shift that we believe is slowly starting to take place in overall healthcare, and genomics is one aspect of that. Jay, why don't you give us your insights on how things are changing?
Yeah, as a natural healthcare practitioner, we always thought that we were working with the root causes of things. When we look at you need to detox, or you have an infection, or you're depressed because you're not getting enough exercise, or you're not eating correctly. And the more I started to work with genetics, the more I realized that no, those are actually symptoms, that there was a much deeper cause to a lot of these conditions. And if you don't know what a functional medicine practitioner is or does, it really is the next level of healing from what's called allopathic medicine or considered modern medicine, which isn't really modern at all. So let's say you go to a medical doctor and you've got joint pain, and the doctor says, oh, you need this drug to get rid of inflammation. They don't really talk to you about what your diet is or what your supplements you're taking, or are you getting enough sleep, or are you getting exercise. But you go to a functional medicine practitioner and they say, oh, yeah, it could be your diet, or it could be that you have infections in your joints, or it could be that you have nutrient deficiency. So it really a better way to look at things at what we considered cause. And that was where I practiced for many years. But if you go deeper into the genetics and the biochemistry, you look at why do you have that food allergy? Why do you have that infection? Why do you have that inflammation? And so it's a next level of why. And so when I started to look at patients that way and really dig deep into the what I consider really the bottom level of why, because that's where we found some incredible answers. When we look at why do you have an infection, it usually means that your body is not fighting infections well because you may have a genetic variant that keeps your body from activating T cells. And to me, that's fundamental. So it's a what I call a paradigm shift in thinking, all the way from thinking that we were dealing with root causes to now really getting into root causes. And the other piece of this is the thing that we've talked about before, GC, which was the genetic compassion in things like depression. So for my own self, having suffered from depression most of my life and beating myself up about it, what is the matter with me? Why can't I just have a better attitude? I tried changing my diet. I tried all the natural therapies that I could do because I'm a natural healthcare practitioner. I wasn't going to go for medications. Changed my diet, tried supplementation. I've done all the emotional work that you could ever imagine, energy work. I've gotten adjusted. I've done acupuncture, NET, NOT, EFT, EMDR, all the anachronisms, and nothing worked for me. It just wouldn't stick. It's okay, a little slight relief there, but nothing. And then when I discovered that I had genetic variants that didn't allow my brain to make biochemical or new neurotransmitters correctly, that was a game changer. And it was like, oh, wow, it wasn't my fault after all. And there was another why that was much deeper. And that when I started taking supplements that complemented my genetics and changing my diet to complement my genetics, that changed my life. And I saw it too with people who were gaining weight and tired. And in the past, as a functional medicine practitioner, we would have said, oh, put the ice cream down and go for a walk. This is easy. But people can't really do that when they're not making energy out of their food because of a potential genetic variant or mitochondrial damage. Then they can't exercise, they feel worse. And as somebody who had chronic fatigue syndrome for many years, if I exercised, it would make me worse. It'd take a couple days of recovery to really get back to some semblance of balance. And so again, I thought, what's the matter with me? Why can't I just go exercise? And why do I crave sugar? And once I discovered the genetic variants involved in all of that and turned on my immune system, got rid of the infections, and learned how to turn on the energy production pathways, and then suddenly my body wanted to move. It was like, I want to exercise. My body goes, yeah, let's move. I got excess energy. Let's go. And I don't crave those things that were putting weight on me. And so that was like a huge shift. That's what I call the paradigm shift of what we're doing is we thought we had the answers, just change your diet and exercise and all will be well. And it really wasn't it.
And I would say, because you said once you got your self sorted out biochemically, you felt like exercise. You said I had excess energy, let's move. Like, I think that's a correlation people don't make. I have excess energy, the body needs to get rid of it. It wants to do something to get rid of that energy. And that's a beautiful thing for people that get exhausted from exercise or just they hurt when they exercise. Because I know chronic fatigue has an element of pain, doesn't it?
Yeah, so that desire and it feels good when you exercise. And that's the key that keeps you exercising. If you don't feel good and it's torture, you're not going to keep it up for very long. It's a human thing. And we can beat ourselves up about, oh, I shouldn't have eaten that cookie or I shouldn't have eaten that piece of cake. But when you get your body balanced, it's like, it doesn't even sound good. It's not healthy in the first place. You know that intellectually, but your body is going, ooh, it doesn't even sound good. It's nasty sugar. I know I'm going to feel bad when I eat it, but you can walk away. And so when you have that underlying biochemistry balance, you can follow diet and exercise and it's pleasurable, where before it's torture. So that's the paradigm shift that really happened. And it's very difficult to get into people's brains because we've been so conditioned to there's something wrong with me. I don't have any willpower. I can't stop eating this, or I should go for a walk. I should walk every day. I should go to the gym. There's all these shoulds that we put on each other and on ourselves worse than anything. And that's why I'm such a fan of getting your biochemistry balanced. And then those things become so much easier.
Yeah. And the idea that we have these genetic profiles and that they shouldn't be looked at is also like an old fat, like we're moving into a place in medicine, if you want to call it medicine 3.0, maybe, where genetic testing is going to be normal. People use it for ancestry. They use it if they want to have a baby to make sure they're going to be, the child will come out fine.
Yeah.
And yet we don't think of it in terms of the everyday stuff that's going wrong. And if you think about somebody that's had a problem that is recurring or just nothing helps, they've been to doctors and clinicians and why? Like you said, the why is in the beginning of the conversation. There has to be a why that nobody that has asked the question about. And so the question is what's going on in the biochemistry, which is determined by the variants that we have in our genetic profile. Yeah.
Yeah, very much. Yeah, and normalizing genetic testing. But like you say, there are different kinds of companies that look at your ancestry or for a specific risk for a specific disease.
Hmm.
And we're looking at something very different than other companies are looking at, which is which genetic variants do you have in biochemical pathways that keep you from being able to exercise or cause you to crave sugars or keep you from making neurotransmitters correctly or detoxing correctly. So it's a very different concept. And I think there's a lot of misinformation about genetic testing out there and what all you can do with it. And so when the practitioners that are signing up, they're like, oh, wow, look at this. This is such useful information. I can do something with this and work with my patients with this in a much more personalized way.
No more whack-a-mole, as you used
Yeah.
to say.
Yeah, that's what I used to say is we're doing whack-a-mole medicine. When I practiced functional medicine, it was like, oh, now there's a virus. Now there's this food allergy. Now there's leaky gut. And now there's an infection. Now there's toxicity issues. We got to do a detox program. But what I saw was everything just kept coming back. The same symptoms would come back with that person. So I was
Mm,
like, why is this happening? There's got to be a piece missing. And I think we found it.
I think you found it.
I think we did.
So, people listening, if you are one of those people that nothing has seemed to give you permanent relief from the bothersome symptoms that you have, I would say take a look at myhappygenes.com. Learn more about, we have a full page on our reports, the test, everything that we cover when you do get your genes tested. Different reports tell you different things. So don't suffer in silence, really. That's crazy. And if you're here and you haven't subscribed, I would encourage you to do so because you don't want to miss one of these.
Absolutely.
All
Do it.
right, peeps. We'll be back next week with another Q&A. And don't forget, you can always send us a question, info@myhappygenes.com. We would love to hear what's on your mind, what you want us to cover. All right, Jay, I'll see you again next week.
Thanks, GC.
Yeah, you're welcome.